Hi folks, it's a concerned Dr. Miskoff and it is May 7th, 2020. I am vlogging from my kitchen in Toms River. It's about 7 p.m. and another day out there fighting COVID-19. I have tomorrow off. Hopefully the weather continues. It's an absolutely beautiful night again. Um, but I did want to make a comment in regards to Remdesivir. We did hear last week on Friday that the FDA, President Trump announced that there was emergency authorization for its use, similar to how hydroxychloroquine was first given that, and we saw it used a lot. We now don't see hydroxychloroquine at all, again, almost overnight. In the last few days, I haven't seen a dose of it written for a patient. I anticipate Remdesivir will be similar. We'll get a huge writing of the product or the medication initially, and then we'll get more data and see if different forms of the medication come out, whether it be an oral form, I'm sure that's being worked on, or a subcutaneous form. Time will tell, but the hope is that we'll have a more easy access to give this to outpatients early on in the disease course. With that said, we haven't received any of Remdesivir that I've heard of as of today. There are rumors floating around that there are doses being released or at least assigned to hospital systems throughout the United States. I'm not sure where we are on that list. I'm not sure how that list has even been created. I believe there was some press on it that there hasn't been any release of information in regards to how there was going to be assignments or distribution of Remdesivir, outside the expanded access and outside of clinical trials. Of course, we are eager and excited to get it so we can give it early on to patients who have, infiltrates or come in with pneumonia on chest X-ray imaging through the ER. When we see these cases, if they're requiring supplemental oxygen, certainly if they're requiring high flow oxygen, we are going to recommend it. And again, it's not clear. It looks like it'll be a 10-day course. Of course, we always have the option of stopping it at 5 or a different day period if there's an adverse side effect, or if, let's say, the patient just does amazing and by day 5 they're great and ready to go home, we may decide to cut the therapy at that point. Again, things can change fast in this landscape, so the hope is that we'll hear from Gilead or somebody in regards to getting the product up front. I would imagine a busy hospital system in the New Jersey, New York, tri-state areas, or other areas in the country that were hit hard as well with high populace or high initial exposures would be assigned or allotted, medication, of course, and hopefully we don't see that they don't get it, and there's sort of a misbalance of hospitals that have it to give early on and those who don't. We'd like to see everybody have an equal shot at getting the medication, or else you may see patients, flocking to different emergency rooms where if it gets out that they have this and others don't. But I think, this will get resolved pretty quickly. I heard there was 1 million doses, so that should be enough to get, most hospital systems that were hit hard up and running. So eager to hear from Gilead or the federal government or President Trump in regards to when will hospitals in New Jersey, New York, other busy areas that were hit hard are going to get Remdesivir, as in fact it was emergency authorized last Friday. If it's going to get authorized, then there should be product to back it up. So stay tuned in regards to Remdesivir and when will we be stocked around the country with enough doses to treat patients who come in, and again, early, and that's the challenge, is getting these medications to patients early right now. Other than that, I did watch on YouTube today the Plandemic movie Part 1. I'm not going to give any comments at this point in time. I may save that for another vlog. It was interesting, to say the least, but we may talk about that in the near future. Everybody have a great night and stay well.